My name is Luke Martin. I'm an intern at the Office of HIV and AIDS within the Bureau of Global Health, specifically on the Key Populations team. My work with LGBTQ within USAID is really focused mostly on the Gender and Sexual Minorities Board. I've been working with them and running for a position on the board itself to work on developing policies that are LGBT inclusive, specifically within USAID and also within our missions and our programming internationally. And then as far as my work in Eswatini with the LGBT community, I worked with various implementing organizations that were implementing our HIV programs and that were specifically focused on key populations, the majority of which were men who have sex with men and female sex workers. A success story that I like to share is really the work that we've been doing on improving the indicators and how our key populations programming collects data. Because as of the last fiscal year, we just started disaggregating for key populations. And basically that means before then we were collecting data for quote-unquote priority populations, which included not only key populations, but also orphans and vulnerable children, adolescent girls and young women, men in general, and anyone else in the general population that was seen to be at high risk of contracting HIV. And obviously that's a huge population to collect data from, and it doesn't really give you an idea of what kind of data is being focused on the populations that are most at risk. And so we've been working heavily with the Department of State and also PEPFAR in general to work towards improving how this data is collected and also how the country teams report this data so that the programming overall is improved and the focus on key populations is strengthened. So my experience with the learning sessions so far has been overwhelmingly positive. I really feel that everything that I've learned so far has been beneficial to the work that I do at OHA. Getting to have people that work with data viz and global health come and talk to you about how it can be implemented within this career field was very important and was dramatically helpful for the work that I do. The resume workshop that they had last year was also incredibly important because of course we are just interns and we'll eventually be moving up in the career force, and getting to talk about resume building within the realm of global health was really, really important and really helped me understand how to portray the work that I've done in global health in a way that will be beneficial to employers like USAID and kind of cater to what they're looking for. The impact that I hope that my internship makes focuses mostly on the key populations that I have mentioned and really working towards improving the programming that we offer to them and improving the policies that USAID and PEPFAR have to protect key populations who are accessing these services in environments like Eswatini, where it's still very stigmatized and criminalized, and ensuring that those individuals in those populations can access the services in an equitable manner, and ensuring that we really focus in on those populations, which of course is where the majority of the epidemic is today.